Hi, I'm Dr. Brawley Wong. My pronouns are she, her. I'm a board certified family physician and I love gender and reproductive health care. Today, let's talk about the different options in the United States for testosterone gender affirmation therapy. The two main options are transdermal testosterone gel and injectable testosterone. If you saw the estrogen video, link below, you might be wondering, what about the pill form of testosterone? Unfortunately, when we take testosterone orally and digest it, it becomes toxic to the liver, so there is no pill form. Let's start with transdermal testosterone gel. The gel is applied once daily to the upper arm and shoulder. It's dosed by number of packets or numbers of pumps. Since the gel is dosed once daily, it creates a nice steady state of hormones and decreases the risk of cyclical side effects like pelvic pain or migraines. Additionally, the gel tends to be less prone to shortages when compared to the injection. After applying the gel, you need to be mindful not to swim or shower immediately after. Ideally, the area should stay dry for at least 2 hours. Additionally, while the gel is being absorbed, you need to be careful that it doesn't rub off onto other people or pets. Next, injectable testosterone cypionate and testosterone enanthate. This once weekly injection is ideal for people who don't want to worry about putting the gel on daily. Additionally, you don't have to worry about keeping the area dry or worry about the medicine rubbing off onto other people like you would with the gel. Self-injection is fairly easy to learn, but the mental emotional barrier of self-injection can be steep. Injectable testosterone is more prone to cyclical side effects because it's only dosed once weekly. Additionally, you might remember from injectable estrogen, injectable testosterone can get a local skin reaction at the injection site. To decrease your risk of this, vary what sites you inject at. Additionally, you can try switching suspensions from cypionate to enanthate or vice versa. Finally, there are a few less common forms of testosterone like the testo pellet and testosterone udecanate injection. Testopel is a small dime-sized pellet of testosterone that's placed every 3 months under the skin of the buttock by a specialist, usually a urologist. Only dosing the med 4 times per year is really convenient, but having to see a specialist 4 times a year can be a barrier to care. Testosterone udecanate is injected every 4 to 10 weeks in the doctor's office. This injection lasts longer because it is oil-based, but because it is oil-based, it has different side effects, most notably anaphylaxis and the potential for pulmonary oil microembolism. Essentially, a tiny oil bubble gets stuck in the blood supply of the lungs, and that can lead to coughing, shortness of breath, and can even lead to passing out. These side effects are very rare, but because of the severity in the United States, testosterone udecanate must be injected in the doctor's office. Once again, less injections, more convenient, but having to get them in the doctor's office can be a barrier to care. So, gel or injection? What's your preferred form of testosterone therapy? What questions do you still have about testosterone and hormonal affirmation? Leave your questions and wisdom in the comments below. If you enjoyed today's content, please like and consider subscribing so that we can get this education to a wider audience. Thank you so much. See you later. Zola.